There you go. Almost. Let me get one more time. Keep that chin up. There we go. Yeah.
If I knew then in the past what I know now, my whole course would have just changed, and my boys would have went straight to the chiropractor. And but about a year ago, I fell out of my garage. I just missed the steps.
I got you.
Knocked myself, my head on the concrete, got a concussion, and it's like ever since then I've kind of been a little bit of a hot mess. Probably about 6-7 weeks ago, I pulled my lower back, and I have no idea. I personally think it was stress induced, and I was helping my son with therapy, and I think I just literally pulled something. Actually, I feel much better. I don't feel pain any longer.
Okay.
Because I did go to my local chiropractor on purpose because the pain was so bad. Okay. So I think the muscle is healing, but I do feel like some pulling and pain in the right side. Okay. Feel a little bit of tingling down the legs.
How far does that go down?
Okay.
Did it go down?
Probably like right here. And it is sporadic. It's not constant. Okay. I get migraines a lot, and I think that you're like,
you're in the right place. Whenever we get injured, whatever parts of our back are moving when we have a fall, those are the parts that get injured. So typically, before we have an injury, our spine is in a certain alignment where certain areas are already doing a lot of work. And then if you slip and fall and hit the ground, the areas that are stiff and protected don't get injured because they're guarded. The brassiere helps in binding, and I've never seen middle back disc herniations. I've just seen an abundance of these last 2 guys and the last 3 guys in the neck, and our world isn't really guiding people to, first of all, let them know that we really have only 5 discs in here that have disc injury, and that's when you're dealing with neuropathies or nerve issues into your leg. That's what we're dealing with. We're dealing with something hitting these wires. It can be the joint, but most likely it's some form of a disc or at the very least bruising around the nerve. You can have a joint, we call it joint effusion. So when you land, the joint gets sprained just like you sprained your ankle. So the ankle joint obviously doesn't have your spinal cord next to it, but these joints, the spinal cord is right next to it. So when you sprain that joint and you sprain these joints, they can swell, and then you get spinal cord or nerve root pressure, we call it. The way I sort of treat this is almost an indirect treatment. I try to spread some of the work away from this area and put it on the middle back. That's why you see Brenda and I, digging hard up here, because the question I have isn't why you got injured here, it's why aren't you injured in the middle back, right? It's almost the inverted question. Why, see, I have headaches here, I have inflammation. Okay, why are you not inflamed over here? And all these other, there are 24 vertebrae and only 5-6 have 99% of surgery. And there's just no TV commercial. The medical world's not bringing it up in conversation. It's like if your tires on your car kept wearing out unevenly, you get an alignment check. You wouldn't just keep on replacing tires. Right. So we live in a world where we want to do treatments on the areas. What can you, laser therapy or electrical pads or some sort of treatment on how are you going to fix my torn muscle? The curious question would be, like I said, if you live down here, what do these discs look like? Because when you're dealing with neuropathy or nerve tingling, stuff like that going into your leg, it's very likely you have some level of disc injury. And the discs are non-regenerable. They're like enamel on our teeth. And so I value that way more than muscles, ligaments, and skin, right? That's all replaceable stuff. That's not the end of the world if you tear a muscle to me. So everybody freaks out. Like, I got torn. Like, it's a muscle. It'll be back in 6 weeks. You understand? No big deal. Arnold Schwarzenegger, he tore them up all the time and they came back bigger, right? But you damage a disc, it's permanent. You crack a tooth, that's permanent. So I put things in different categories, and disc health should be, to some degree, investigated. That's what anyway. So we're just going to go through your spine a little bit. I call it like a placement test. I'm just going to see, how much these other areas, how much they don't like me, perhaps, how well they like to move, and try to move some pressure on.
Sounds good.
Sound good? One deep breath in for me. And then head back for me. Exhale. All the way out. Keep letting the air out. Let your jaw relax. There we go. Deep breath in. Very good. I got you. Exhale. Let all the air out. There you go. Let all the air out. All right. Deep breath in. Deep breath. Exhale. Let your chin go down and the jaw open. There you go. Here we go. Very good. Slide down for me.
Wow.
You did good on your side. Yep. Deep breath in. Let your back go. Let all the air out. There you go. Let all the air out. All right, other side for me. It's okay. Other side. And then exhale, twist. There we go. It's okay. Face up. For that adjustment, we are trying to adjust the SI joint. The issue with going any harder than that is that you're probably going to get the lower back moving. You understand? I'm sure I could. The level of force that I placed into that joint should be enough to move the joint. Does that make sense? Well, Ed, I think if you pushed harder, you might be able to get it to move. Possibly, but I don't want to risk tormenting this area. Does that make sense? So I'd rather, my plan would be usually to spend some time soft tissue-wise, loosen up the joint, so no joint should be so heavily restricted that you have to He-Man it. Do you understand?
Yeah.
And so this sometimes you see on different videos, people do just scary looking adjustments, and I go, it never supposed to be like that. It shouldn't have to be your back shouldn't be so stiff that it requires these, really deep adjustments. Wow, the whole right side of your neck, very obvious. See it big, everything's popped out to the right. So okay, yeah, not small. You love sleeping on your left side. Got to get off that left side.
Okay.
Everything is over to the right. So I'm going to show you. I'm going to tilt you to the right. I got you. Wow, almost right there. Right there, your bones are level. And it reminds me when I was a kid and I crashed my bicycle and my handlebars aren't level with my tire or even with my tire. I had to tilt you about 30 degrees to the right to get your bones level, but now obviously your head's tilted. So what do you want, Dr. Ed? I want your head on straight at the same time your bones are straight. What this does is going to pinch your left lower. So because everything is shifted to the right up here, your head favors the left side and you're going to overwork the left lower part of your neck because the right upper is being avoided. The real problem is right up here. And tomorrow morning, oh yes, I felt it next morning, Ed. It was very sore. And so we're going to go real gentle. We're just going to start softening up. It shouldn't take much time for somebody to find this. It is not subtle. You got to get this bone in here. I got you. Yep. There you go. I got you. You okay? Here we go. I got you. We're just trying to move this top guy. Let it go. 1 second. Almost. Let me get one more time. Keep that chin up. There we go. Yeah. Very good. Turn your left. I got you. So we're just going to loosen up this upper neck now. That's your headaches all right here.
Yeah.
Wow.
I can look in the mirror and see it.
Yeah.
I can see it in photos.
There's a bump in my neck. I'm sorry. Yeah, the world. I grew up with a chiropractor as a father. Brenda and I had, I thought everybody had a chiropractor as a father. I thought they did, like when you left the hospital with your child, they trained you on how to check their vertebrae. And, I did. I thought, I didn't realize until later on in life, I was like, one of my friends had a headache and I said, go get your dad to adjust your neck. And he said, well, my dad just gave me some candy, gave me some Tylenol, And I was like,
right.
Right, I got some pills.
Yeah.
And I was like, what's that? I said, my dad adjusts my neck when I get a headache and my headache goes away. And I'm a homeschooled chiro kid. We're a little
so weird.
Gonna be a little bit weird. Gonna be a little bit isolated.
You're so lucky.
I've never found success manipulating, adjusting the injured areas. I've never seen it. They are teaching it. They're teaching that we need to fix the subluxations, that the bone is out of alignment. We take x-rays or palpate or however you want to determine the position of the bone, but they're telling us that we have to adjust the subluxations, and I'm saying that I've never seen that be beneficial. I've seen too much success and benefit by balancing the spine, by not demonizing the areas that are injured, but saying that those areas are injured because they're doing everything. They didn't do anything wrong. They're simply doing everything, and we have to bring all the other vertebrae online. And so part of the headache up here isn't that this area is aging. It's actually because it's so stiff up here that it's not moving, which congests the area. So the mobility of the vertebrae keeps the area clean. Tissue cleans itself and imbibes fluid into itself by mobility. Feel the difference? I mean, it's just...
Absolutely.
This side's all soft over here.
Yes.
Yeah, just I mean, it's almost like Ed, you spent 3 times as long rubbing the right side of my neck than the left side. Correct, because you don't need, I'm almost done with this. I'm almost literally done rubbing the left. It feels, there's a tiny bit right there, but, you know, I'd almost make the argument that you really shouldn't even rub the left until you get the right to catch up, right? I don't want to, see, the left side will loosen up way quicker than the right side because the left side's already loose. So if I loosen the left and I loosen the right, I haven't balanced you, right? I just manipulated everything, right? So I would say that almost the first 2-3 treatments should almost only be on this right side. This is the curve that your neck should have. This arch is where we go in what I call the next phase of care. The first phase of care is to get everything moving. The second phase of care is to stretch your spine into the right position permanently. So we first get your spine moving like clay, and then once your spine's soft like clay, we can start reshaping the vertebrae, getting them to permanently be in the right position. Just this left side. Focus right there. There you go. I know. Yeah, you're amazing, Ed. It's okay. It's okay. I know, that was a tough one. That's the deepest level I'm going to take you to today. Do you wear a lot of heels or lifts?
No.
No? Okay. Like your static position is your toes are pointed out. Your feet should be more up here. Does that make sense? Like when your foot's relaxed, like look up for a second. Like your toes are like your foot should be like relaxed.
I don't know.
That makes sense?
Maybe I just am used to stretching.
You know, I'm just saying.
I don't know.
I'm just gonna show you. Your foot should want to relax like here. Does that make sense? But if I let go of your foot, like your foot wants to
get back down.
Well, that puts a lot of stress on your ankle. You understand? The static position of your ankle is keeping a constant pull. Like this healed wrong is really what it means to me. This all healed. Like you tore the fabric and then you pulled the fabric taut and then you patched it with it taut. Right? So now the overall length of the fabric is longer. Does that make sense?
Gotcha.
It healed with a large scar because you didn't close the wound. Somebody should have butterfly stitched this. I'm so sorry. That's part of what I'm thinking here. But because you do it to this angle too, it's like you're inverting. Like your static position over here is terrible. I mean, it's really bad. I'll try to show you. Your foot should be here.
I can feel that in my lower back.
Oh boy, we got. So it could be, and that could be it. That could be it. It could be an adaptation to your body is trying to move this around to relieve pressure on your lower back also.
Okay.
So because this is torn, your body's trying. This fabric here doesn't have the pull power to pull this back up. That makes sense?
Yeah.
This tissue here has been sprained, obviously, like you said, from the fall, and we need to rehabilitate it. This has to be worked on for you guys.
We become so tough.
Yeah.
You know, it just feels like you have way too much weight on your pad of your foot. I want the weight on your heel. About 80% of your weight belongs back here, and that's part of why this bunion formed here is because you have too much weight on your toes, and that's part of why I asked you about lifts. Do you get the idea, right? If you have your heel lifted, that shifts the weight to your toes. Did you used to wear lifts? No? No lifts in your history. Okay. I'm just trying to figure out why there's so much of a shift. And it can be from your back. Maybe it might just be because your lower back, and spine are in avoidance. There we go. I'm just gonna check this ankle. I got you. I got you. Yeah, it's all bound up in there. Like it doesn't feel like there's any shipments coming in here. So like the UPS trucks are not driving all the way down to the end of the cul-de-sac. They're just making U-turns in people's driveways, and you're just waving. This area's like waving, like, hey, come on, guys, I'm down here. You understand? Nobody's coming down to. What is it?
Gosh, I'm more of a mess than I even thought.
Like Uber Eats and like the Lyft. Nobody's driving down here. There we go. Yeah, it's just bound up right here. Feel that lump right there? This is the brassiere binds up your middle back. So when you fall, this area isn't allowed to participate. It sort of just watches from the football sidelines. And so this guy's just sitting on the sidelines, just having a good day, and the lower back's just on the front lines getting beat up. And so my new analogy is nobody wants to eat a peanut butter and jelly sandwich where the peanut butter's all in one clump and the jelly's all in another clump. right? And then you take a bite and all you get is bread, right? And then the next bite, all you get is peanut butter. And the third bite, all you get is jelly, right? You're like, Ed, you suck at making peanut butter and jelly sandwiches. You're supposed to take the knife and you're supposed to spread the peanut butter. You're supposed to spread the jelly, you know. And so that's really all I do for a living. Is I take the clump of peanut butter, you understand, from the lower back, and I spread, does that make sense, the work, so that you have your whole spine effectively functioning for you, and you just don't have it all harnessed in one area. Like I said, and going back to what I was saying earlier with my father, he's been injured by people that kept on adjusting his lower back, and that eventually caused, you know, permanent nerve injury from continual manipulation of the injured areas.
And that's why you went to chiropractic school, or?
Right. Well, it was actually in chiropractic school. That's where it happened. So you had people that were training. You know, you can't blame
He
them.
went to chiropractic school because chiropractic
Helped him,
So
but
it
then
started out good.
right. Chiropractic helped him before, but then he went to chiropractic college to learn about it, and so he had students practicing on each other, and then they kept on trying to help my father by adjusting him where he's injured, and it leads to him having permanent nerve damage. You know, it's like, geez, don't touch the areas that are injured. But somebody's got to find that up north, you understand, and try to help you break this wall down. I need your middle back working more, the lower back working less. Your lower back just, it's like a tooth. You like to chew on those areas, and we have to learn how to chew. Get the idea right here. That's where your back needs to start learning how to bend. Everything I do after the initial adjustment is to make the next time I adjust you better. That makes sense. I use the soft tissue work as a way to coerce the area to move better, so that I can use each adjustment as a ladder to make your spine more malleable, ultimately with the intent of stretching. That if we don't stretch, that there can't be any permanency. Does that make sense? That the adjustment itself doesn't permanently change your posture. That your alignment, the curve in your lower back, even the mobility will just stiffen up again. And it leads to where people are left with, they're told to have to go to chiropractors 3 times a week the rest of their life. You know, and that disheartens people, because it's like, I can't do that 3 times. you know, and so that's not my message for you. My message is you be here every day, and then once your spine is moving properly, and I've taught you how to stretch, you can come in once a month or once every other month. Does that make sense? And you'd be able to go much longer between adjustments. You okay? You okay? Breathe.
Yeah.
All right. Please let me know if I'm going too hard or. So the left middle back controls the right lower back. The left middle stiffness causes right lower abuse. The abuse of the lower back inflames the nerve, which, remember how I talked about the nerve flow from the back, you know, like the power supply to the ankle? You know, so I bet you there's a diminished level of healing going to happen in the the right ankle compared to the left, because of that lump on the left middle is essentially sending all the work to the opposite lower part of your back. There you go. We can't get your head back until we get the chest in. So it's called coupled motion. We have to loosen up the chest so that the chest can start going forward. Does that make sense? So we can retract the head back. Like right there, feel that?
Yeah.
It is real tight right there. Almost crunches around in there. We gotta release that. Right there. You keep coming back to the same spot, Ed. I know, because I don't like it. I don't like it. It's not as bad on this side. Up here, it's like your right upper, then it goes down to left mid. Keeps crossing over. This side's not as tight up here on the shoulders.
It's wild.
We'll cool it down. It's coming on. Air's coming on.
You're very like zen right now, so I thought she's doing great. You're suffering in silence.
I do a lot of yin yoga.
Okay, cool.
Although this year did throw things off a bit.
Right.
But I do it at home as much as
Oh, very
possible.
good.
Yeah, right there. Wow, that's. What did you do?
I have no
That's it.
idea.
That doesn't exist over here. Feel the difference? I mean, there's
Yeah.
just nothing. There is no. I have a rib injury. Like if you landed or bam, hit that or something, probably even more than a year and a half ago. It's like a car mechanic putting a car on a lift and seeing dented frame and like something collided with this.
I know when I was little, I fell down my grandparents' steps, like on my bum, and knocked the wind out.
Yeah, that's just somebody's got to find that. It should be pretty obvious, and that has to be untangled. It's been injured, and then it healed incorrectly, and now it's what happens is the area gets so tight that it chokes itself, and it won't self-resolve. It has to be opened up a little bit to allow it to detangle. Wow, right there. Just right there. Right there. Oh man. Are you happen to be near the Gulf of Mexico? No? Are you near the Gulf?
Yeah, sorry. Yes.
I mean, or a salt pool or something with salt that will. I mean,
We have a salt pool and, I think we're like 10 minutes from the Gulf.
either that or you have to get into a bathtub with some salt. I need you to do that tonight if you can get
Okay.
in a salt,
Sure.
medium,
Epsom salt.
Epsom salt, or the Gulf of Mexico for 10-15 minutes and soak, and that'll draw out this acidity because it has two ways out of your body. Either one, your bloodstream and you pee it out, or two, it goes right through your skin, and your skin's gonna be less noticeable to you than if you make your blood do it.
Yeah.
And your pH of your blood goes down from all this lactic acid. It leaves your muscles and then goes into your blood, and then your kidney and liver have to process it. And so
I do a lot of salt baths.
good,
at
please, yes,
home.
yeah. Especially after
So-
treatments, yeah, you need to be. It's the best thing for this. Real quick, right here came up. Real quick, that spot is an oil well. So, maybe a lot of. It's like I can tell which stains have been here longer based on how much comes out of them, kind of idea, right?
Yeah.
Right. The lighter stains are going to clear up faster than the stains that have been there longer, and then the severity of the stain. So, what are you, carpet cleaner for a living? Yeah, pretty much. Yeah. It's like a restaurant. I'm showing you what food to look for. And once you eat the right food, you can perhaps take some of the knowledge you've learned today and try to. You'll know what I don't want. I don't want to eat that. I want to find this, and I don't know the answer for finding it. Just I would call up different chiropractors and ask them if they have a lot of therapies in their office. If they say, "Oh yeah, we have lots of gadgets and gizmos," and you call the next chiropractor, and because you're looking for somebody who's going to use their hands. Maybe they have a massage therapist working for them, and then you could ask, can I observe an adjustment? Can I observe one of your adjustments before I pay money to consult? Oh no, we have a very closed door policy. We don't let anybody see anything. Okay, thank you very much. You call the chiropractor. You know, you might have to go through 20 to find somebody who's willing to, yeah, you can come on in, come talk to me I'll show you what I do. You know, and then you can converse a little bit. But if it's so closed-minded that, you know, if somebody asks me that question, I say, sure, come on in. I'll show you what I do, but maybe, you know, I'm sure that's rare, but.
Well, I've come in and let people watch me get worked on, or the kids if they have kids. So they can
Sure,
see
sure. It shouldn't
if
be
they're
this.
nervous, you know.
It shouldn't be this closed-minded. Nobody gets to see anything. You have to
Right.
pay $500 before I can even see. You know, it's like, gee whiz. I don't know. So,
If I
Tell me.
knew then in the past what I know now, my whole course would have just changed, and you know, my
Right.
boys would have went straight to the chiropractor and.
Right. Well,
never-
it's not your fault. The medical world had a lot of success in World War II, and the baby boomers, you know, they just taught everybody to go to the medical world. You know, the World War II generation taught the baby boomers that, and so there really wasn't any. You didn't ask questions. You know, it was just what you did. And chiropractic didn't grow in World War II.
Yeah.
There was no influx of need for more chiropractors when we're at war, and there was a giant influx in antibiotics and pain meds and surgical techniques. And so after World War II ended, we had a large disparity, and you know, we're still living the consequences of it.
Yeah.